Hi, I'm Krista Bushkowski.
And I'm Matthew Lechner.
In this presentation, we are going to be discussing whether or not the Affordable Care Act is feasible for America.
And also, we'll be discussing if national health care is a reality for America.
Hey, Matt, do you know anything about the Affordable Care Act?
Well, I know that there's a lot of confusion going on with the Affordable Care Act. There are many Americans that do not know what their benefits are with the Affordable Care Act. The problem is that there are too many options that Americans can choose from. They could choose from public or private insurance and care. Then there are all these new regulations, taxes, mandates, and subsidies that go along with the Affordable Care Act. I know it is trying to increase the quality, availability, and affordability, but it's not going to help if people don't know what they're signing up for.
I agree, it is very confusing for Americans. There are other healthcare systems in the world we could have in place instead that would make much more sense to our citizens and myself including. What I'm trying to say is that maybe the ACA isn't all that great for America. We could choose one system like the Bismarck model, the Beaver Ridge model, or the National Health Insurance model instead of trying to incorporate all of them into the system like we have in place now.
Don't you think it is odd that no other country is using the same kind of healthcare system we are using?
Yes, I do, Matt. The ACA is supposed to reduce the growth in the U.S. healthcare spending, but that is what other countries are working for too, right? How come our system has to be so confusing? I've heard that there are many people that still have problems with it, even though there's a promise that everyone is covered at a reasonable price.
I have also heard that. For a methodology, I actually read this story online the other day. This lady had spent the entire morning trying to find a doctor in her area that offers the health care she required and who accepted her Obamacare insurance. 7 out of 9 doctors in her network do not offer the service she needs. One out of 9 doctors offers the services but does not accept her insurance. The other 1 out of 9 she has not been able to get a hold of. She thought when she got insurance it had improved her situation. However, it appears that she was mistaken. She doesn't think it's fair that we are required to have an insurance that doctors can refuse to accept. She questions how she can benefit from Obamacare.
Well, I'm sure she is not the only one having this issue. She probably missed some fine print that was located in the 22,000 pages of regulations that are now in place because of the Affordable Care Act.
Why don't we discuss those other systems that you mentioned earlier?
Let's start with the Bismarck model. The Bismarck model uses an insurance system. The insurancers are called sickness funds, usually financed jointly by employers and employees through payroll deduction. Unlike the U.S. insurance industry, Bismarck-type health insurance plans have to cover everybody, and they don't make a profit, where the U.S. does make a profit. No one is denied coverage with the Bismarck model, and I also know most hospitals are privately run. That being said, tight regulations gives government much of the cost control that the single-payer Beaver Ridge model provides.
I'll start explaining the Beaver Ridge model next. In this system, healthcare is provided and financed by the government through tax payments. Patients have access to any type of care that they require, and they will never see any medical bills as a result of their visits to the doctors or hospitals. Many hospitals and clinics are also owned by the government. Some doctors are government employees but there are also private doctors who collect their fees from the government. These systems tend to have low costs per capita because the government controls what doctors can do and what they can charge. Like the Bismarck model, no one is denied health care in this type of system because the goal of the system is to provide high quality medical care rather than seek profits. I feel the government has a lot of control, though, through this model.
Let's move on to the national health insurance model. This being a universal single-payer healthcare system, it would be paid for in part through taxes based on income replacing insurance premiums, co-pays, deductibles, etc. All plans would have the same benefits and networks and would eliminate our current multi-tiered system. The difference between single-payer and Obamacare is that Obamacare has both public and private insurance and care, while single-payer is a public insurance only with public and private care. National health insurance plans also control costs by limiting the medical service they will pay for or by making patients wait to be treated. In some cases, patients can't wait, which can cause problems. Since there's no need for marketing, no financial motive to deny claims, and no profit, these universal insurance programs tend to be cheaper and much simpler than American-style for-profit insurance.
Well, Krista, by the sounds of it, the Bismarck model seems to be the best and most simple. It has to cover everyone. No one is denied coverage, and the government has a lot of control. Also, most hospitals are privately run. I do believe there are other countries, such as France, that are doing very well with this type of system.
You are right. The biggest costs with the Bismarck model is that people's payrolls are deducted for insurance purposes, and the insurance industry doesn't make profit. I really believe this system would be much less confusing than the ACA that we have in place now.
I think that the Bismarck model would be very effective for America. And I also think it is feasible for us here in America. There's too much confusion with our system right now, and this system would calm some of that down. It may take a while to put this into play since we recently had the Affordable Care Act put into play, but it would definitely be worth that wait.
I completely agree with you with that conclusion.
Some recommendations should be made to have the Bismarck model brought into consideration. If the Bismarck model doesn't get passed, then I recommend people start reading their 22,000-page contract of regulations of the Affordable Care Act, or they talk to the professionals so they know what to expect from their healthcare system.